Hey everybody, I want to make a video while it seems to be quiet enough in the vehicle, and it is the first fall day, in my eyes anyways, here in Dallas, as it is really cool out. It feels great, no hot sun, so if you like the cooler weather in Dallas, now's a good time. Got Dr. Axel over here chilling, and I just got adjusted by Dr. Lee over in Plano. Dr. Stephen Lee at Best Life Chiropractic. He's a good friend of mine. That's where I interned when I was finishing chiropractic school, and his friendship and his open door policy to me to be able to continue to get adjusted in very effective ways for my lower back, especially here, has just been incredible. His clinic was the one that introduced me to Shockwave therapy not long ago, and I, of course, if you've been paying any attention to my channel, added that to my clinic in the last month or so. It has been an incredible benefit. It is, to me, the most efficacious and greatest utilization of another modality outside of these hands, as chiropractic is done by hands. And for me, chiropractic, in terms of principles, philosophy, my own, feelings and philosophy about chiropractic, the history, me personally, my history as a patient, and then what I've been able to do for patients, I believe the adjustment is the most important part that a chiropractor can offer. I will say that this modality, the shockwave therapy, has been an amazing addition and seems to really work well with chronic pain. So chronic scar tissue, deformed tissue that has been causing people chronic aches and pains, whether it's elbow, knee, hip, shoulder, back, whatever. Not for neck pain. That's a whole other conversation. But, in a nutshell, the mechanical waves, the acoustic waves that come in through this shockwave machine, I certainly wouldn't recommend. And it is actually contraindicated on lots of the content that exists out there. And not content, but like peer-reviewed papers and guidelines of the people that actually created these machines, to not put it on the chest, not put it on the neck. But all that being said, for some of the worst, most chronic, not disabling pain, but chronic kind of sticking around, lingering pain, whether it's post-surgical or from an old rotator cuff injury or from a bursitis or a tendonitis, shockwave is the way to go. I put my money on it. I put my reputation on it. That is why we added it to our clinic. So with that, I'm going to actually tell a story about a failed shockwave experiment and a positive shockwave experiment. First positive shockwave experiment is older person comes into me with a really achy, gnarly right SI joint, right lower back, right hip, kind of more like piriformis, glute area pain. And it is just not going away. She's had it for years and years and years. And we were adjusting a few times using some of our Theraguns and just adjusting by hands, really weren't getting anywhere at all. And with one shockwave session, slept through the night for about 4 days. With the second shockwave session a week later, slept through the night for almost a full week, felt about 80% better. And for at least 2 or 3 of the first days after shockwave, the pain is 100% gone. So you tell me, what would you do when you've had pain for 10, 15 years in a spot that's keeping you from sleeping? What would you do for 2 to 3 years of 2 to 3 days of no pain, and then with a three-minute treatment to have virtually 85% reduction in pain? A lot of times with chiropractic, but even with now shockwave, you might get someone who's had terrible debilitating pain in a region for years to say, I feel it, like I know it's there, but it's not even interrupting or debilitating at all. That's typically what I see with shockwave when it comes to these chronic pain patients. Now, as for a failed story or a shockwave story or chiropractic story, because you can't have it all one way. Like I tell my patients, chiropractors love to put on social media about how they all have it one way. But you know what? You got to have both ways. You got to have the give, you got to have the take. You got to have the good, you got to have the bad. And that is a patient who's also had horrible back pain for years. He's been quite stable, actually, in my clinic for about the last 8 months to a year. He's done really well with a couple of combinations of adjustments. He had an exacerbated flare-up. He was on a really hard time in the morning walking, and he came in, and this guy, I know him. he's really tough to adjust in the sense that he's very, very sensitive. Your margin for error as a practitioner is like this much. So it's like, I've had a few patients like that where like, you could, push into some tissue with an adjustment. And if it's, not exactly where it needs to be, even by a couple of millimeters, believe me, that disc and that spinal cord is going to let you know that you are pushing in the wrong spaces and they're going to be worse off. So we just did some gentle, soft tissue work and just kind of maneuvered through what we call in the Gonstead work, we would call pumping. And then I did a 3-minute session of Shockwave on the lower back, around the surrounding tissues to see if it would calm down. And when he got off the table, oh boy, it did not calm down. It was just as bad as when he came in, meaning an acute lower disc type of situation, an acute kind of spine related annular fiber deep, dural tension, intrathecal pressure, all these fancy words, which really just means it's a disc spinal column problem that's impinging upon nerves in some manner, irritation to nerves in some manner. That's not a Shockwave situation. And that's not going to be the answer to those patients. They're still going to have to come in and be told the truth, which is when you come in and you can't walk right, you better have a few days to a few weeks available to make chiropractic your priority. Again, especially to somebody like me, and that's not braggadocious. That's saying that I have a ton of certainty, a ton of confidence that when people come into my clinic and they have a lumbar disc or spinal related problem, when their disc kind of went pop or, felt like a sharing, stretching, bad back feeling that they had to drop everything when they reached to bend over and pick something up or their last few repetitions in the gym. When those things happen, like I'm so confident, so certain that I know how to take care of them, all they need to do is be fair, not to me, but to themselves about the time that it is going to take to feel better. Sometimes it's 3 to 4 adjustments over 2 weeks. Sometimes it's 7 to 8 adjustments over a month and a half. It just depends on, where you are in your journey of how much damage has been done to those joints and the reoccurring, look at Axel's face, the reoccurring deformation or degradation, of the tissue that happens within the body based on repeat micro traumas that now became this big, oh my God, what do I do now? Do I need to go to the hospital? Because we just see it all the time. But it's understanding the neurologic, physiologic, and biomechanics involved in those types of injuries that only gives me the certainty that I know how to care for them. And then what you have to understand is it does take time with those injuries. You cannot go into the chiropractor's office a day after or the same day of sustained injury like that and get a miracle adjustment that's going to make you 100% better or 100% stable. If you come in a week after doing nothing and time is beginning to make that wound a little bit easier and you can move around a little more with a little less pain, and then you get one of those miracle adjustments, that's possible, especially when you're younger. But as you're older and more susceptible and more familiar with these injuries, where us, 40 to 60-year-old people are in those age ranges, it takes a little bit of time to get stable and then start doing, the passive modalities of chiropractic, if Shockwave's even a thing, which in this particular circumstance, acutely it wasn't, but I'm sure it will, once it's becoming more stable, help with some of the tissues that have been in spasm, okay? And once that becomes stable, you can go back to your active therapy. You can start listening to your physical therapist friends. You can start listening to your chiropractors on the internet telling you that exercise is all you need to get stable, laying on your stomach and whatnot. Those exercises are there after the adjustments have been done and getting the pressure off that disc, getting the pressure off that nerve, starting to adjust what we in chiropractic call subluxations and then compensations to get somebody actually stable and retraining their brain and retraining their body for those pain patterns and actually doing something called beating the pain gate cycle, and also then creating that active rehab through, because you can't get a joint better without compression and motion. And if you stuck around long enough to watch this video, you now know all the truths about getting, recovering from injuries to the lower back like that. And guys, with that, I'm going to get on the road and get on about my day, and hopefully person pulling into this parking spot doesn't destroy my car. See ya.